My name is Tiffany, and this speech is for my oral interpersonal communications class. The focus of my project is to show how individuals that work in a hospital or any work setting that is similar to a hospital know how to communicate with their patients and family members of a patient in any emotional state. People go through some of their toughest times in a hospital, and if you don't communicate with them in an effective emotional state of mind, it could make things worse for both them and yourselves. I am going for pediatric nursing, and I have heard many tragic stories that have happened to families and their loved ones at the hospital. It is a sad and tough situation to go through, and each patient and their family face many challenges. If a nurse or a doctor can communicate with the family, focusing on their emotions, it can make an effect on how they perceive and go through things on a day-to-day basis while they are in the hospital. Individuals' emotions can be broken down into 3 different parts: the way they feel, how they communicate, and the thinking process that they go through when at the hospital. Individuals face many feelings while they're in the hospital. How individuals react to these feelings is another thing. Every individual, no matter their age or gender, go through things differently. Some face and go through more feelings than others. Some show these feelings for others to see, while others hide their feelings from others and do not express the way they are feeling. Individuals cope with situations differently as well. Some seek out help when dealing with tough situations, while others avoid the help and keep to themselves. I currently work in a nursing home, and I have seen many of the times where a family loses a loved one and they are in the resident's room talking and dealing with the loss together. And there is usually one person from the group that walks out of the room and goes and sits in the lobby for a while by themselves, away from everybody. That individual is an example of how someone who doesn't like to talk about the situation and would rather cope with the loss on their own terms. Throughout this project, I have found many different websites saying how women are more likely to express their feelings over men. And I would guess that everybody would know that anyways, because that's what you see a lot of times. When you're in a hospital setting and you need someone to talk to besides just your family, there's different groups that the hospital can direct you to go in to talk to different people. There is many different support groups that can help you through the tough time. There are different support groups you can join depending on your situation. There are many support groups for dealing with the loss of a loved one, dealing with a miscarriage, and dealing with the loss of a child as well. It just depends on your situation and what support group you would be directed to go to. Another emotion that people go through is communicating. How you as a worker can communicate with the patient or a family in a tough situation is that you can talk about what they are going through, answer any questions they may have, and if you aren't able to answer them, find someone who can. Give them feedback about what they can do to make the situation better, such as talk with the other family members or friends, and to make their loved one that is going through the tough time feel as comfortable as possible, just in case anything would turn for the worse. You want them in the best scenario and the best place they can be. How well an individual can communicate with others is another big factor when it comes to communicating. According to the Institute for Clinical Research Education, communication is a transaction between 2 or more people, with all participants having an active role in the process. A speaker transmits a message and must ensure that the message is delivered clearly. A listener takes delivery of the message and must be an active listener. Effective communication takes place only when the listener clearly understands the message that the speaker intended to send. How individuals communicate regarding how they feel about the situation is another factor that people face. Talk about their feelings with friends, family, or someone at the hospital. Or they can go by showing certain emotional responses to the situation as well, such as crying. They get angry at the situation, some yell, and some can go to the church chapel and pray. There are many ways individuals respond and communicate to situations, but those are just a few. Cultural differences also play a big role in how individuals communicate. Individuals' beliefs and religion play a major role in how they communicate as well. Psych Central is a website I found online did a study, and in the study, investigators examined how Dutch and Japanese people assess others' emotions. Researchers determined Dutch people pay attention to the facial expressions more than Japanese people do. On the other hand, Japanese people express emotion in the tone of voice, not in the face. Some cultures don't show any emotions at all. It's considered a sign of weakness if a man cries in some cultures, and as well as hugging and kissing in some cultures are forbidden upon. Another downfall of communicating with someone of a different culture is that there may be a language barrier. If this is the case, many hospitals have translators that you can call in to help you communicate effectively with the family, or sometimes there is another nurse or doctor that may speak the same language, and it would be in the best interest of all to let them do all the communicating with the family because they know the language and know what is and isn't accepted in the culture when it comes to how they express and communicate about their emotions, because the last thing you want to do is upset the patient or the family when they are already going through the tough time in their life. Another emotional state that people endure is the thinking process that they go through. According to Alexandria Sifferlin from Time, we have 6 emotions that we put into action: happy, sad, afraid, surprised, angry, and disgusted. Everyone thinks differently depending on his or her age and the gender and their cultural beliefs. Some act upon things without thinking them through first, while others think about all aspects, and with that knowledge they act upon what they have found to be their conclusion. This reminds me of when individuals are in a hospital and are told the bad news by the doctor, and you see some individuals stare in awe as they try to gather all the information, and sometimes you see the individuals act quickly upon what they are being told. And with that, they start yelling out, some punch the wall, and others will walk away just to be by themselves. That is an example of someone who is immediately acting upon their feelings without thinking them through first. In conclusion, I have found that emotions are one of the biggest factors to face when you are dealing with other people, especially if they are facing tough times like many do that are in a hospital. Throughout this project, I have learned many things regarding emotions and how they tie into a hospital setting. I learned about the different emotions that people can feel and go through while in the hospital, whether it is the patient or their family. I want to be able to connect with their emotions and help them through their tough time as much as I can.